Department of Nursing, Office of the Directorate of Medical Education, Government of Telangana for the first time in collaboration with UNICEF. On behalf of all the nursing fraternity of Telangana state, I thank the team UNICEF for coming forward with a proposal of 6 webinar series for the nursing professionals. As all of us are aware about the corona pandemic, which has made the world upside down, which is created a health emergency. And it has, we have many challenges and experiences with the corona. And this virus has humbled all the developed nations in the entire world. And in this scenario, in this COVID scenario, the experiences and challenges and the role of the nursing professionals is very crucial. So I thank UNICEF once again for coming forward to conduct this webinar. And I also thank Dr. Ramesh Reddy Garu, DME of Government of Telangana, and Additional Director of Medical Education, Dr. Vani, for her presence and giving message and best wishes for the webinar. And I also welcome Dr. Sri Krishna. I also welcome Dr. Sri Krishna, State Consultant, UNICEF, and Dr. Sanjeev Upadhyaya, Health Specialist, UNICEF, and Dr. C.N. Bhargavi, lecturer from Ram Manohar Lohia Hospital, New Delhi, Dr. Himabindu Singh, HOD of Neonatology, Nilofar Hospital. And we have requested Dr. Punita, ma'am, former Dean of CMC Vellore and Executive Council member of the Indian Nursing Council also to address this webinar. But Madam has conveyed her best wishes and she said she is unable to join. And we also thank Dr. Suji Mol, Principal,
Dr. Vidyalata,
I welcome all the panelists and all the participants, that is principals, faculty, and all the nursing professionals for this webinar on nursing care in COVID scenario, care of self and community. Thank you. Now I request Dr. Sri Krishna to proceed.
Thank you, ma'am. The Additional Director of Medical Education is on a field inspection, but she has conveyed her best wishes and has said she will try to speak over phone because she's not able to connect from the place where she is on field. I'll get her online soon after Dr. Sanjeev Upadhyaya's comments. Dr. Sanjeev Upadhyaya is the health specialist for the UNICEF Field Office of Hyderabad. This caters to the 3 states of AP, Telangana, and Karnataka. And he leads the entire set of interventions and the programs on behalf of UNICEF. Over to you, Dr. Sanjeev.
Am I audible, Shri?
Yes, sir. Please go ahead.
So at the outset, I would like to thank Additional Director Medical Education, Government of Telangana, for giving us this opportunity to organize this webinar for the nursing professionals. I am also thankful to Ms. Vidyalata, Dr. C.N. Bhargavi, Professor Himabindu Singh for sparing their time for this important webinar. We have a very tight, very packed agenda, so will not take much time. just to convey that nursing professionals, they are backbone of health system, and their role becomes even bigger in this time of COVID. So they are in forefront. And I'm just taking this very important, very interesting findings from Israel. In Israel, they undertook a study, and there they found that the healthcare workers who are working in non-COVID health facilities, they got infection more than the ones who were posted inside COVID facility. And the reason is simple. Because once you are posted in COVID hospital, you take all precautions. But if you are not posted in a COVID hospital, you become lax, you become complacent. So my request to all of you that no matter where you work, you have to take full precautions as much as possible. The purpose of today's webinar is to equip you with the right set of information so that you not only protect yourself but also patients around you. We saw in different healthcare settings in India, excuse me, that when people, they don't follow certain protocols, they'll end up in a situation where the whole hospital is sealed or all staff is sent on quarantine. It's very important for all of us to understand that if we have to protect ourselves. These are unprecedented times. We cannot afford to shut off any hospital. We need to keep on running. It is not that we just want to protect ourselves or we will run. This is like a war, and we have to fight like a soldier. No matter with whom we are fighting, our soldiers, they put their heart and soul. They fight with full vigor. And the same is what we expect from, the world expects from us. And this we can do if we equip ourselves with the right kind of information. And if I compare it with a war, means right kind of arms and ammunition. So this information about COVID-19, the usage of personal protective equipment, the right kind of masks, following proper sanitation SOPs, cleaning SOPs, they all are like arms and ammunition. So we all need to follow that. And what I shared with all of you from Israel experience, that we should not become complacent no matter where we work. We should consider every individual to whom we meet as a potential source of infection. With right kind of information, we will feel that we are fully equipped, we are totally, loaded with right kind of ammunition, whatever this country requires to fight this pandemic. So my best wishes to all of you. This is a wonderful session, and I need to count, probably it must be maybe 50th session which UNICEF is organizing in Hyderabad through Hyderabad field office. So that team is very experienced. They successfully hosted almost 40-50 sessions so far. This is a new norm and we need to learn it. We need to learn how can we attend trainings using technology without moving from our workplace. This is first such workshop, as Dr. Sri Krishna and Dr. Vidyulata also mentioned, that we have 5 another programs which we specifically designed for nursing professionals. So try to make best use of this opportunity and see how best we can serve state, government, and our society's interest. I am proud of you, more so because this is an year of nurses and midwives. This is our year. We have to prove ourselves that we are not less than any soldier. So my best wishes to all of you. Please keep yourself safe, secure, yourself and your families, and my best wishes to all of you. Thank you. Over to you, Dr. Sri Krishna.
Thank you, Dr. Sanjeev. Thank you for all the support and the motivation from the UNICEF team as well. Without much delay, we go ahead with today's session. It's a 35 to 40-minute session, and this is a little different to what you've been through in the last 1 month. Dr. Vidyalata tells me we've had a lot of webinars on COVID, small webinars at each nursing council in within each city as well. But this is something which is being hosted by the government of Telangana, and the people we are trying to cater to are the warriors on the field. So let me start my presentation, and then we'll take it forward from there. So COVID-19 reminds us of the crucial role nurses play, and this is what the world has realized. It takes a calamity for heroes to come up, and the heroes in this calamity that we are facing are the nurses. The heroes are the nurses, and we all should be proud of the work and the service which we're doing. And rightly so, year 2020 is called the year of nurse and midwife. We know that the nurses and midwives play a vital role in providing health services. These are the people who have devoted their lives to care for mothers and children. They give life-saving immunization. They save lives in the operation theater as well as on the field. And they are often the first and the only point of contact in many communities and countries. Still, it's not enough. We need more of these guardian angels. We need 9 million more nurses, and that is the only way in which we'll be able to achieve universal health coverage. And that's the reason why World Health Assembly has called this year as the International Year of Nurse and Midwife. So what is it that makes the nurses so special? We have these very inspiring stories from the field, and I want you all to take a minute just to reflect on what our own people have done. This is a story of Ajo Jose. He's a nursing officer in the emergency department of RML Hospital in New Delhi, and he's been part of several humanitarian missions so far. What has he done? He has been the part of the task force which has gone to the coronavirus hit city of Wuhan very early this year and got the Indians stranded there. He said it was an option for him to refuse, but he chose to be part of this mission. There are many of us sitting here and also many more on field who are part of this mission to save lives. Another story of Archana Rana, who is a senior nursing officer from AIIMS New Delhi. And she says mental strength is very important during this period. And it's been a month since she has been away from her family. She is a mother on a daily basis, and this is not a responsibility she can give it to somebody else. But she has undertaken something bigger than that and is at AIIMS taking care of the sick patients there. We have another nursing officer who says it's all about teamwork. It's not an individual who can make a difference, but a team that can respond to a calamity like this. And together we can achieve a lot. And then work is joy. And work has always been a joy for all the nurses across the different states of India. He says very pertinent point that the patients cannot recognize us. Look at him. Nobody can make out if this is really Shaukat Ali. But then that's the commitment and the will of each one of us. There is no eye contact with the patient, and the one whom we are serving probably doesn't even recognize us once they leave the hospital. They might even be our own neighbors. And that shows how much of commitment we all have towards this and fulfilling the job responsibilities. Another story from the field is of Mrs. Pratima Naik. She works in the epicenter of all this, the KEM hospital in Mumbai. She's the nursing matron there. And her responsibility has been to train. And she has trained nursing teams. And this hospital is a 2,200 bedded hospital. And she's in charge of the nursing there. So each one of us is doing our bit in trying to save ourselves, our community, and the country from this current disaster that we are in. Another story of Asmol, who took care of two old age people, an elderly couple aged 88 and 90. They were tested positive for COVID-19, and she had to go into quarantine herself soon after she took care of them. It's not easy to go into quarantine. It's not even her fault. Every day, probably she would have been thinking, why did I even end up in this? And I am suffering because somebody else got positive. And she has to stay away from her family and then take care of herself amidst all the fear and the scare in her mind. And what did she do to feel better? She followed a daily self-care routine. She read books. She watched movies. She kept herself relaxed to reduce anxiety. And now she's back to work and she feels very good. And she says, I've been waiting to come back to work. She has a very good advice for us. We need to trade our freedom for the greater good of public. At the same time, don't ignore ourselves. You can do a lot more if you are careful, if you are caring about yourself and also about your community. So wash your hands frequently and thoroughly. Stay home whenever it is necessary. What is it that government of India has done to help the situation? There have been a lot of steps taken by the government. I'll briefly tell you so that this gives you that confidence that all is not lost and we are not in this just alone. So there have been proactive, preemptive and graded response by government of India. There have been a lot of advisories. I have never seen this much of technical information come from ministry in such a quick time. There are technical guidance for quarantine, surveillance, containment, testing. There is also a SOP for you when you step out. There's a SOP for you how to behave in public, what to do when you go to the vegetable vendor, what to do when you are at home. So there's a lot of information and all of it coming directly from Government of India. They've strengthened their testing capacity. As of now, they have enough to test more than 1 lakh tests per day. The concept of the flattening the curve has been that we will not be able to cater to the large number of sick patients all at once. And it took some time for the government to expand the bandwidth of the health infrastructure. And currently there are 1054 dedicated COVID hospitals with 1.8 lakh beds, 2,600 COVID healthcare centers, 7,962 COVID care centers, a total of staggering around 10 lakh dedicated beds, which are there exclusively for just this disease. They've also ensured logistics, supply of essential items, 51 lakh of PPEs which are supplied, 87 lakhs of N95 masks, and hydroxychloroquine tablets. There's been comprehensive guidance on non-COVID essentials and financial arrangements are in place. We've also we're facing a scenario where we can't meet or exchange knowledge. So we've been able to leverage technology. They've rolled out eSanjeevani teleconsultation services. MCI guidelines have been issued. We have Arogya Setu for surveillance, and there's a legal framework to help the entire health community deliver its service. Now let me request Dr. Bhargavi. Before I shoot any questions, Dr. Bhargavi, we'd like to listen to you on your experience of working on field at RML Delhi. Please just give us a glimpse of how your day starts and how your next day starts as well. Dr. Bhargavi, please.
Thank you very much.
Ma'am, the echo will come if you're logged in on 2 devices. So you can exit the other device or reduce the volume of the other device. Please go ahead.
Okay. Thank you very much. I'm happy to be part of this webinar. And luckily, I'm on off today. That is why I could attend this, because I have just exchanged my duty with my colleague, so that I mean, it was not for this webinar, but for the other aspect, because I was to finish some urgent work by yesterday. Anyway, maybe it's for good. Everything is for good. So I also hope for the best and prepare myself for the best. That is my philosophy. RML, I have been with RML hospital since 1994 onwards, and I have joined as a tutor there in college, School of Nursing. It was a School of Nursing, and in 2008, it's upgraded into College of Nursing. And the programs are running on. I have been associated with the teaching and clinical supervision and all other activities of the UG and the thing. Later on in the COVID area, when it started, there was as like any other institutions, in RML is also not an exception, that how to move ahead. Earlier, it was one or two cases, and there was enough time for the other institutions, and it was started in the local government areas and in one of the one or other institutions, Saptajang and like that. But suddenly it started one after another, making each and every central government hospital as dedicated COVID hospitals and preparing the areas for the COVID, managing COVID patients. But our hospital setup, what is the thing that it is not only RML, all the hospitals are not set up, or the construction or the buildings are not that much suitable for having an ideal or standard COVID management areas. So that was our first problem with removing the patients and isolating some area, preparing the isolation rooms, preparing the ICUs, preparing the human resources, and providing them training. But it was such a challenge among the nursing staff, not only the nursing team, but the entire hospital management, to prepare the hospital for receiving the patients. But like as Dr. Krishna has rightfully mentioned, that the guidelines which has been which is there in the government website as well as WHO website has helped a lot for us also to prepare the things. But again, we have failed to provide training to the individual nurses who have been posted in the clinical area for the management of things. So it was, although there were a lot of webinars, a lot of online classes, but as we know that we are routine, I mean, we are forced to work in a routine like in the area, then coming back and then taking rest and looking after the family like that. From that, there is a sudden change of a continuous duty for 14 days like that, and then the 14 days quarantine, and in the PPs, and 6 hours duty, 6 plus 6, 12 hours duty, how to manage, and in a rotation things, as the entire hospitals had to work hard and to manage the COVID. So what we have done is to make committees for accommodations, committees for quarantine, committees for infection, committees for rotation, and committee for grievances. So many committees with important senior faculty, including faculty, also involved in this, and that's why I also the chairperson of the quarantine and accommodation committee. So I'm now directly in connection with the frontline workers, their challenges, their problems, and their issues, and taking up, managing, and linking with the administration and advocacy, and in all the aspects. So it will take maybe an hour to explain the entire process, but to limit in words that right from the teacher position to right now, I'm just taking a multi-facet role in management of this pandemic. Thank you.
Thank you, ma'am. So let me just take you through the new normal. So what has changed in the last few days is that we have a new way of life now. The new normal, and this is national directives for all of us. One, wearing a face cover is compulsory in public places. You don't wear a face cover or a mask, you are liable to be fined. So you must be wearing a face cover. You need to have social distancing. 2 gaz ki duri is a must in all public places. Shops need to ensure that physical distancing is there and not more than 5 people are there. So if you visit any shop and you have more than 5 people, don't go in, or please tell the shopkeeper that he needs to have social distancing and also less of crowding. A large public gathering or congregations continue to be prohibited. And then you have marriage related gatherings where not more than 50 can attend, funerals where not more than 20, spitting in public places is punishable, and consumption of liquor, pan, gutka in public places is prohibited as well. The new normal is these two. So life has changed now, and wearing a mask and washing your hands is normal. Never before was it considered less important by us, but now it needs to be followed by all of us. And there are some normal etiquette, and let me take you through this. When you say care of self, this is what you need to do. First, greet people without any physical contact. The Indian way of namaste is the best way in which you can interact with them. Maintain physical distance of at least 1 meter with them. Wear a reusable face cover or a mask. Maintain respiratory hygiene. Cover your nose and mouth while you're coughing or sneezing. Wash your hands frequently. Clean and disinfect. Frequently touch surfaces regularly. And what is it that you should not do? Don't travel unnecessarily. Don't spit. Don't touch your eyes, nose, and mouth unnecessarily. The virus is a big sized virus, and it spreads primarily by droplets. The droplet which somebody else has it will then be there in circulation, but it will not stay floating in the air. It will settle on surfaces. Imagine raindrops. They don't just stay on in the atmosphere, right? So they settle on objects. This object, imagine rain has fallen and those drops are there. You go and touch it and that wetness is onto your hand. The problem is, if this stays on your hand, it's okay. But you take your hands to your mouth and your nose and to the conjunctival area. That is where the virus can then enter your body. So don't touch your eyes, nose, and mouth. Don't discriminate COVID-19 patients, caregivers, or others who are fighting against it. They are just like us, and tomorrow it could be one of you. So do not discriminate. Keep the number of guests in any social event to the minimal, and do not visit any crowded places. So these are all general etiquettes, do's and don'ts. Now, Dr. Bhargavi, if you can tell us, now that we know what precautions need to be followed by us in general, forgetting the fact that we are nurses. Now, our profession calls us. Many of the nursing faculty who are part of this webinar have to resume their duties. They need to get back to the colleges, get back to the hospitals, and resume teaching. The world has not stopped. So what are the precautions that they need to follow? And Dr. Bhargavi, your voice is a little low. Could you please come closer to the mic so that everybody can hear it well?
Okay. Yeah, thank you. This is again a question that is asked a number of times among the various forums of teachers and principals and all. Exactly an answer for this or a standard answer, giving a standard answer or a general explanation for this is very difficult, because each institution, the number of students, the number of programs, and all are varying. Some of the institutions has more than one program, and the student strength is also that much high. And some of the institution has only one program, but still they will have a high annual intake rate. So in this situation, uh, again, it depends upon the state also. So the state like Delhi, it is near to impossible to resume the college and all these things in the current scenario, because there is already, it's a surge and the community. So, and secondly, here in the institutions like ours, it is a time for the preparation for the examination and the things, because 75 to 80% of their syllabus and the things are covered, and few clinical experience only left with the students. So this is the time, August and the September is the time for their examination. So now we are preparing for the students for the sake of examination purpose. And the remaining clinical experience has to be started, and the other resuming the normal things have to be started based on the institution and the state specific. Now, if at all the institutions have to be opened by July or August, then there is a lot of work to be done by the each institution, specifically because maintaining the norm of social distancing 6 feet away apart from each other and contact hours, and all these things have been a challenge. I mean, it's going to be a challenge for each institution. So either we have to plan it very properly and scheduling it with limited numbers from the final years first, and then to the second, the third years or second years like that, or according to the whatever is left for. We have to really schedule it very much. And beyond all these things, the college has to have other additional committees like infection control, sanitation, waste management, hostel, and college premises, and scheduling. Many aspects have to be prepared before resuming the college and the reopening the college. At any cost, I don't think that any institution will be in a position to start with the full strength uh, suddenly or immediately after the lockdown. It needs a lot of preparation, scheduling it, and maintaining distance in the classroom. Most of the institution has a small classroom and adjusting with the students. So we have to really work out. But there is no problem in finishing the theory classes because most of the institutions have done it already through the online classes and videos and demonstrations and webinars and all this, all classes and theory, all these things are very easy, and tests are also possible through the MCQs and the things, and case study presentations and group works, discussions, all these methods which we can adopt to finish the maximum theory aspects and all the teaching aspects. Exams, if at all to be done, again, it depends upon the state and the institution. We have to plan it with a limited number in the lab and with very limited members and maintaining all the precautions that are required. So these are the plan of our institution for preparing reopening when we are going to reopen. Thank you.
Thank you, Dr. Bhargavi. So that's how the plan is. There is no clear-cut idea of where and what will happen. This is an extraordinary circumstance to the entire world. All of us are facing it. So to begin with, I would summarize that take all the general precautions. Please recall the do's and don'ts. Make sure you're following all of them. Coming to the teaching at colleges and bedside, there are specific precautions you will have to take, and each state probably would be at a different position. Now let us go from the college to home. And the first thing we all do when we go back home is to look at our parents. Let me invite Dr. Himabindu Singh. She is the professor and head Department of Neonatology at Nilofer Hospital and well known to all the nurses across the state. Dr. Himabindu, could you tell us how we can take care of the elderly at home who constitute the highest risk for COVID?
Yeah, a very good afternoon. Thank you, Sri Krishna, for involving me and arranging this beautiful webinar, especially for our very important human resource, the nursing personnel, who are the backbone for us. May I know the audience? Is it all the nurses? Can I speak in English or any local language?
Yes, ma'am. You can continue in English, please.
English, okay. So basically, apart from we are all doing duties, maybe overtime now. We are all under rotation. We are all, now the direction is given by the DME that only 50% should be on work and 50% at home. And it is all, a different sort of lifestyle we are leading now. We have never seen this type of, lifestyle earlier. And we always were, and we are worried now about, because we are seeing so much of positivity among even our doctors and nurses, our postgraduates, nursing students. So they are, even though they are wearing all, taking precautions, still they are very vulnerable, and we are seeing some of the tests are coming positive even among us. So, but we have to be very careful, because apart from doing our professional work, we also have other responsibilities. We are our, we have we have parents at home, we are children to them. We also are, maybe most of us may be married, husbands and children to take care of. And home is so very important for us. So if we are very happy at home, or if our family is healthy and happy, and we are not, we are not in anxiety, then we can work more productively at work also. So it is very important that we should take care of our own health and also our own family members. So coming to the elderly people, now most of us, we are in, I think they are, we all know by now, they are very vulnerable. They are more prone to get infection, and because they may have less immunity, they are more likely to, get into complications. So it's very important that when you enter home after your work, so first of all, you should, you already, Sri Krishna and others must have told you, you should see that you protect yourself at work. Please wear the proper PPEs. The discussion will come, and once you have to doff those things properly in the workplace. And while entering the house, see that you come clean. That is, you wash your hands, even maybe have a bath before you enter your house, maybe somewhere in the outside or the ground floor or somewhere and change your slippers, change your dress, and come completely, totally with washed hands inside your house, especially when you're meeting your parents. And I think it's very important, because they also will be worried about you. So you need to spend some time with them, because we are telling them not to move out. Most of the elderly people are being advised by the government of India also not to go out for a walk also. So they are all now confined in the houses and homes and rooms. So they may have anxiety, depression, they may have a lot of boredom, and they may feel disconnected of the family, because most of our health professionals, we may not meet them, because of we are so much of time is going with our profession, with extra duties. So nobody's talking to them or meeting them. So they may feel, they may have a lot of mental health issues. So please try to spend some quality time with them, and keep it, at least talk to them very frequently. And then just see that you can involve in some common activities. There will be some common interests, maybe playing games, or some hobbies. When with them you can sit and spend time with them. And actually just talking to them, they feel very happy. Most of the elderly, especially in this, you just ask them what they want. They just want you to talk to them, and then just some communication. How are you? What you have done today? And just get some, make the atmosphere very light, and sharing some jokes, and doing some exercises, yoga together, and doing some activities which they enjoy. These things are very very important. Just, I think it's very important to listen also to them, and not just be on the media. Many times when we come home, we just switch on the TV, and then we are always busy with our WhatsApp, and with our phones. And even if they're around us, we hardly look at them and give an eye contact. So please avoid that. Please give them make them feel important, and make them feel loved. I think these are a few tips which I can share with you.
Thank you, Dr. Himabindu. So make sure that their concerns are met. They are also as scared as you. At least you are in the nursing profession, so you know a little more about it. But they may not have that. They may not have that amount of information. So make sure you convey all this to them. Yes, ma'am.
Yeah, I just want to add, see, because the elderly, they may be diabetic, hypertensive, they may have health issues, chronic health issues, and they're not able to go to see a doctor for regular checkup. So at least ensure that they are having some teleconsultation with their doctors, or even ensure that their supplies of medicine is there, and they're not short supplies of their, daily medicines which they take. And take care of their health, and their diet, and their mental health, physical, mental health, and make them feel happy. Whole atmosphere should be very much joyful and positive at home.
Yeah, so it's very important to look at all domains of health, the physical and the mental health as well. Ma'am, if you can take this question further, Now that we know what nurses should do outside when they go out for vegetables or to the grocery or just step out, now we know that mask, hand washing, all these are the new normal. You have also spoken about what to do once they come back home to see their parents and their elderly. A big component which we are likely to face in June and July is the concept of stigma. And this stigma is inherent because of the nature of the disease. It's not because the people around us are wrong or are bad. It is just that the disease scares you all so much. How many times have we proactively gone ahead and embraced someone with a disease? This one is much more because it spreads easily from one to another. Most of the health professionals are not aware, especially if you're asymptomatic, whether you're sick or not, whether you have the virus or not. And this unique scenario where you don't know if a particular nurse is COVID positive or negative, is symptomatic or asymptomatic, and when nothing is known, the concept of stigma and the thought of discriminating the nurses becomes very, very strong. Much part of this lies with the other person. The one who is discriminating against you has to change. But what is it that the nurses can do in this unique scenario?
Yeah, I think first thing is where I agree with you, Sri Krishna. Most of our own people, when I'm working at Nilof Hospital, so my own lab technicians, nurses, they keep telling us, see that wherever they're staying, it seems, without even knowing the status, people around them, the other apartments and nearby houses, they tell, oh, this person has come from the hospital, they're working in this hospital, and they're looking at COVID patients. So they are actually maintaining that they are not talking to them, or not even, earlier they used to share food and all those things. So all wo sab kuch band ho gaya. So they are facing that sort of discrimination already. They are actually telling us when they are in the workplace that these things are happening at home. So basically, see, the sisters and all of us, the nurses, we should basically, the public is not, as rightly Dr. Sri Krishna said, it is they're not there are many things, false myths are there, that even if you that nothing will happen if the person is standing at 6 feet away, and then if he's not coughing or sneezing, and if he's maintaining social distancing and is taking all precautions, it doesn't spread just like that. So just looking at the person, or even sharing that street, or the common pathway, or those things, there's such sort of nothing will happen with that. So that is, knowledge is very, very important. So we are the nursing personnel, or we the healthcare professionals, we have knowledge. Maybe the public has not that much knowledge. So give them that leverage. It's okay, maybe they're not aware of how this virus is being transmitted, and unnecessary causing stigma around. So let's be positive, and let's not think about no, this is only temporary, maybe 6 months to 1 year, everything will become normal. And maybe if we can try talking to them, and just maybe through a common friend, or some person who's really having that empathy and concern about you, through them we can definitely talk to them. But then otherwise, don't get into, don't get hurt, or don't get too much emotional about it. Be strong, and maybe you can talk to your close friends. Definitely communication is very important. If you're feeling stigmatized, and you're feeling that you're left alone, and you're not I mean, you're feeling concerned, or anxious about it, I mean, you're not liking things the way people are looking at you, please to talk to a close friend. Talking is very, very important. Please keep your communication channel very, very important. And try, if health, of course, information and literacy, this health information empowers people. And actually, it is, most of the discrimination is due to misinformation. So this is, the government is already doing that through a lot of channels. They're trying to educate the public how the virus actually spreads and how it doesn't spread. So that's very, so let that they are doing. So what we need to do is keep our mental strength strong, be positive, just don't get affected by what people are doing around you. If they are negative about you, just ignore, and have you try talk to your close friend, and take family support. Your family is very important. Your husband, wife, children, the parents, some of friends and relatives, some of them who are actually understanding the situation can be of a great support to you, at least mentally. So this is very important, because if you're mentally you're not strong, in fact, it will weaken your immunity further. So that will become more bad for you. If you're you can become prone for the infection yourself. So mentally keeping your this thing, mental strength is very, very important. So do yoga. You can actually divert your mind. You can have something like, routine for yourself. Even if nobody's talking to you, have self routine. There's nobody, you can engage yourself alone. You can have some fitness routine. You can do meditation, eat healthy food. And maybe for so many years we were so busy all the time, we never had time for our own hobbies. You can start your guitar, you can start dancing, whatever you want to do in life. Think about it, what you never had time for doing all those. So you can engage yourself and into all happy things for yourself. So these are some few tips which I think I just wanted to share with you. Anything?
Thank you, ma'am. It's very important for us to know what works, and what works very well is information. See, imagine if somebody had to tell you about bypass surgery, heart transplant surgery. You really wouldn't know enough, and that is where the scare lies. Suppose somebody has asked you to drive a Ferrari car. If you don't know how it works, you are likely to hit, and then you will never enjoy the experience. The same works even for COVID. Please learn. Please continue to search for information, and a complete information which can answer all your queries. Only that alone will keep you strong and sane and safe. The next step after you know something is to share it. Share it with people who matter to you. How many times have you gone back home and made your parents and grandparents sit down and taken a 1-hour webinar like we all are doing? Tell them all that you know. In that process, you will get some more questions from them. I recall about 2 months back when we started this, my daughter asked me, why are you throwing away this chocolate wrapper? Then I said there could be some chance of the virus on it. Then she asked me, how much time does the virus stay on the wrapper? And that's when you start looking for more information. And the moment I realized that porous surfaces, non-porous surfaces have a different time when the virus is there, and no object will have it for more than 5 days. Even if there is a lot of virus on it, beyond 5 days, in fact, beyond 3 days, it will not survive. Then I got more confidence. And I am now able to handle things at home and also with others, only because we have more information, and that information will make us confident and keep us safe. So get more information, learn about it, and then share it with everybody else who matters to you. That helps a lot. So empowering with health literacy, this is the most important one. And if more people around you are well informed, then the stigma will not be there. The stigma comes only because they are half informed, and this half knowledge is very dangerous. Let me now go across to Dr. Bhargavi. Dr. Bhargavi, we know that the nurses are very important in healthcare. So what do you think will be the role of these nurses as the lockdown norms are getting eased across the state of Telangana? And is COVID going to be a bigger threat, especially for nurses who are the first point of contact? There's nobody who can replace them. You could have a video consultation for a doctor, but not for a nurse. So how do you perceive the next few months for the nurses? And can you tell us how to cope with this fear when these nurses go back to the hospitals in the best way possible?
Okay. Okay. The first thing is that what do you think about would be the role of nurse as lockdown norms are eased? Okay. The most important aspect you have already mentioned and explained, that by understanding one's own role, what role each person have to discharge when the person is at work. So the nurse's role are different for different categories. So it's very, very important. So whenever we take it term nurse, the image of a nurse working with the patient, that comes forefront. So because that is a thing, but there are other categories also. They are taking the middle level managers and the senior level, higher level managers, and in the teaching position. They are also nurses. But here, especially for these pandemic situations, what I am focusing is on the true nurses, those who are going to work with the patients. So there will be the OPDs will be reopened and the departments will start reopening. All the healthcare workers and the hospital is going to work with the full strength. So in that case, what is the main preparation a nurse has to do is that to think that ourselves is also a possible source of infection, and the same is the patient also. So the universal precaution that once upon a time after the HIV/AIDS started introduced, the same thing has to be followed in this pandemic situation also. If we take the history of nursing also, so that main important aspect in the nursing is the hygiene and keeping hygiene and cleanliness and infection-free control atmosphere. Throughout the course of teaching of nursing also, we keep on stressing this aspect, and it's one of the important aspects to prevent maximum diseases and maintaining the health. But by virtue of the increase in the technologies and increased antibiotics, various medications, and other modalities of treatment, this point of hygiene, maintaining hygiene, environment, both personal and environmental hygiene, has been a secondary or even a lower consideration in all the aspects. Because there are antibiotics to protect, so there is, even if we just make some mistake also, it's going to save. That was the scenario. And that aspect or that thought is now has to be changed, because no antibiotic or no medicine is going to save in this COVID scenario. So it's very important that the role. Now, the nursing officers who have to think each, I remember one of my students got sick and a very severe breathing difficulty and about to intubate the things. But how come she got it? Because in the course of her posting, she just helped a patient to take a position, to turn the position, because that patient was unable to take the position. So she helped the patient because she didn't feel that to leave the patient in her sorrows and the difficulties. So that action, and of course it was a non-COVID area, therefore there was only the gloves and the surgical mask with her. So she got infected. It is not her fault. It is not the fault of patient, but the nursing which have been learned that not to neglect the patient, but to take care. So, and when she got sick, when she approached the emergency and all, everybody was asking, why did you do that? When you know that this is the COVID area, why did you do that? So this is not the time, because whenever we have been tuned, we have been trained to take care of the patients. So we give secondary to our self-protection, because first thing is the. So now when these things are there, we need to have a change in the nursing care strategies. We need to change our procedures and protocol, and at the same time keeping in mind the patient's need. I can tell you that in the present scenario, the patient care needs are neglected in the hospital. They will be better cared at home, because there's only one and the people can take care. There are a number of doubling and tripling which is happening in some of the states in the same COVID areas. So you can think that each individual patient's care needs to meet the patient's need is simply impossible, and will put the nurse itself into danger. So many things which we have to consider when we are discussing this issue. If there are patient, if there is adequate staff, if there is a good PPEs and the other protective things are available, there is a very good hospital infection control committee. There is a strict monitoring of infections and the spread. There is a strict demarcation of the dangers or the most sensitive areas or breach in PPEs or anything. So then only we can safely work that yes, there is a chance of a nurse carrying an infection to the home or the things is very, very less. But when there is any drawback or anything is deficient in any of this aspect, then everybody is in danger and everybody is to be suspected as a carrier of the infection. So coming to these people coming back to home. So before itself is, before going to the duty itself, one has to think that there are limitations in cases, there are limitations in protection of each other, or somebody is there to take care. There is nobody to take care of each other. We have to take care. So I myself, and before I will go to the duty, I myself prepare with sufficient bleaching powder solution with me, hand sanitizer with me, extra mask with me, and clothes with me to wipe, and tissue paper with me, and disposable things also I keep in my bag, and I dry myself and sanitize the things I go home, and I do it. There are cleaning staff for cleaning the areas, but I do take care. I once again clean with a bleaching powder. I take myself the things, but because I have a time to do all these things. That's not the scenario in the nursing officers who are working with the patient. Here, the senior level officers, that is the supervisory level officers, have to take the role of protecting these people by checking it correctly and ensuring that the safe environment is there for each nurse to practice, and they are no more a carrier or carrying the infection home. And the highest senior most level, like nursing superintendent and chief nursing officers, their real role is multifaceted. They have to, this is the time for these high level senior nursing officers to act like an advocacy, and standing for the rights and welfare of the each nurses, those who are working in the area. And this has to be very strong for the nursing service system. And that is lacking in also in almost all the states. The many of the areas, the nursing manpower is very, very weak, and that subordination feeling that has to be overcome, and the system, the government has to strengthen them, and the power to take the decision and to make guidelines and to support and to strengthen them. That is very, very essential. Then only we will be able to manage the system, or to manage the hospitals and in the community also. And if we are protected at the hospital, then definitely we will be able to protect the family also at home also. Otherwise, there will be a fear always, and everybody, as on date also, each nursing officer is working with fear that they don't want to go home because they have a fear, and they want to get it tested and to make sure free negative, then only they all want to go home and to join with the family. No matter whatever be the day they are away from the family, but they are more concerned about their children and the elder parents and other people. So this is because of the lacunas or weakness in implementation of the guidelines in the hospital system. That can be rectified only through strengthening the nursing manpower and sitting at the higher positions, and providing them the decision-making power, and providing them the authority to formulate the guidelines and welfare activities for the nurses. Thank you very much.
Thank you, ma'am. Let me just take a minute additionally to add to what you've said. And I have 5 Panchapandava Laga. These are 5 things which I would suggest that we could do. And I am sure this will help. So let me just take you quickly through these. How can I be safe? One, read. There is nothing which is more powerful than knowledge. But what is important is read from reliable sources. Don't read newspapers, media, or WhatsApp forwards. Don't read them. Go to Ministry of Health website. Go to Government of Telangana's website. Go to their Twitter pages and their Facebook pages. Go there and read. Read PDF documents which are released by Indian Nursing Council, Indian Medical Association. Those are reliable information. They will keep you safe. Share and care. Share this information with people who are more worried than you. And sometimes you may be getting more knowledge from them. Care for them. This is the best time you have in the world and over so many decades to care for each other. Don't lose this opportunity. Tell yourself in a couple of months, COVID will go away, vaccine will come, and I'll be back to my routine. I won't have enough time to have dinner with my people or to spend this much of time. I may be off to a movie, that person may be off to something else. They'll keep playing, they will be watching TV. So we never get this time again. So care for people, share the information that you know. This is the best time to do it. Express, and this is very important, and I want all the nurses to start doing it. Just as you have adapted to WhatsApp, you have adapted to a mobile TV nowadays, adapt to Twitter and Facebook. The government nowadays is more responsive, and the media also helps in this way. If you have a certain fear, if you have a certain thought in your mind, as long as you're following the rules of the decorum and are expressing it in a proper way without hurting anybody, you are free to express in this world. Please write it to Twitter, to the ministry's webpage on Twitter. Please tag KTR if you are in Hyderabad. They will get back to you on it. And there are specific answering sites. For example, COVID Seva is the name of the Twitter handle by Government of India. If you have a question, please ask it and it will get back to you. So start expressing yourself. Many a time you may even feel better even if you just ask the question. Nobody has an answer for it because they are also as well informed or uninformed as you are. But if you ask, you are surely going to feel better. So express yourself on Twitter, express yourself on Facebook. Stay safe. There is nothing that can compensate for being unsafe or safe. Wear a mask, wash your hands, maintain social distancing. If the government says stay at home, stay at home. If the government says go to work, do it. Whatever be it, do not deny yourself these opportunities of staying safe. That is a must. And the last one, reinvent yourself. There's no point in trying to be sad about it or wonder what comes up next. Instead, stay in the present. Think that you have a good opportunity to try something new. Reinvent in terms of your thinking, in terms of your actions. If there was a bad habit you had to get rid of, now is the time. If you were biting your nails, you want to get rid of it, now is the best time to do it. If you wanted to daily read a book before you sleep, now is the time to do it. So please reinvent yourself, and these are the ways in which you will stay safe. Trust me, all these are very small things, but just like drops of the ocean, all these, when you put it together, you will no longer feel scared to do what you do. And the more informed you are, the better you will be at your workplace as well. So this is what matters. Now, Dr. Himabindu Singh, next question for you, ma'am. Now that we know what needs to be done, we would like to hear from you what the nurses can do once they go back home, which is majorly taking care of their family. So please tell us how these nurses can take care of their children at home. You're a pediatrician and neonatologist, and you've seen the adolescents as well as the mothers. So look forward to your answer.
Am I audible, Sri Krishna?
Yes, ma'am, please.
Yeah. Taking care of children, yes. The children could be as small as a neonate to a adolescent, like you said. So children are very, very precious for us. I think most of the nurses, whether they are men or women, they are so concerned about what happens if I carry this infection to my home, and especially children. So they're very much worried. And like already Mr. Bhargavi has said, most of them are actually keeping away from their families to keep them safe, because of their worry of transmitting the infection home. But then, since this infection is going to stay with us for some long, may not just finish off in 10-15 days, it will be there for quite some time. We need to, this is a new normal, we need to get habituated to keep ourselves safe in workplace, and while going home, we have to go home and we cannot be away for a long time. So when we go home, and because children also will be missing you, most of the children, we have seen in the media, children are telling where is mommy, and then people at home are telling she's at work, she's very busy. So such things, and so it's very important that we connect with them, but safely. So what do we do? So as I already rightly said earlier, so when you enter your house, don't try to take all the precautions so that you are completely clean, and leave all the clothes and your hands. You take a bath, and all that precautions have to be taken before you enter the house. And second thing, when there are children at home, they may be maybe they don't have schools, colleges now, so they are at home since all the time since last 2-3 months. So we need to be really concerned about them. They have their own issues. They are getting bored. They may have mental health issues. They may have physical inactivity. Some of them may have malnutrition. Some of them, it can be obesity also, malnutrition. And then they can have media addiction, and they may get into, because we are away from the work and they are alone at home. They may have a lot of problems because nobody's really supervising them. So these are some of the issues. It could be, if it is a child, a small child, he requires safety, he requires supervision over safety and nutrition, growth development. But then when the child is an adolescent, he requires, more time for talking to them, knowing what is happening within their mind, and mental health issues become more important. So these are, depends on what your age of the child is. We need to give that sort of, we need to fulfill their felt needs. So their needs are depending on what the age is. So keep your children safe at home, and if they are better to be under supervision with some elderly at home. And I think nowadays the maids are not being allowed in. We are not allowing a lot of people to come in. Even the everything is, we are locked down at home, and we are only one person is, maybe one or two are taking the responsibility of going and getting our groceries and all that. So we keep your home safe. So don't allow many people to come in, and everything, even relatives, friends, all parties and all those things can wait. They can, you maybe we have to postpone for 6 months or so, and we can always be connected through media, online. We can keep talking to them and maintain that connect. So we need not have social distancing, means need not be mentally distancing. So we can be connected with our relatives and friends. So we have technology for that. That's very important. So keep your home safe. Don't allow many visitors to come in, and as less possible as, many people coming in and out, that should be reduced. And depending, and when they are, because they are at home, they need to be supervised. So if you have elderly at home, maybe they are the best persons to take care. Like third is, take care of the needs of the child. So depending on the age, again, as I already said earlier. So if your child is very small, then you have to see that they're not neglected for food, safety, and the cuddling, the love, affection, hugging. All these are very, very important for the child. So we need to come into contact. So you need to be safe. So that's why it's very important that you take all the precautions. So for a little, you can spend a lot of time. This is the best time, like Dr. Sri Krishna said. All these years, I think many people say, "Arey, we didn't get time at all, and we never knew how the children grew." And many of I remember, I know, especially our doctors, they say that they were so busy with their OPDs and all that, they never realized when their child slept home. Then by the time they go home, the children already sleep, and then they are just growing over the years, and they realize when they are sitting over the marriage, Array, now my child is no more with us. He's already married, left house for job, or for after marriage they leave home. That is the time we realize that we should have spent some quality time with our children. So please, I know this time will never come back. So this, you can spend a lot of quality time with your child. So you can sit with them, play with them, or crack jokes with them, become like, friendly with them. I think it's a stress buster for us also. I love to spend time with my children. It is so nice for us and also for the children. So you can do something like common things, reading a story before going to sleep, hugging them, and just talking about what you have done throughout the day, and what, just singing songs, dancing, drawing, many things you can do along with the child. And you can do some exercises in the house, and yoga. And then you can also spend a little older children, they love to you can teach them about cooking, because most of the adolescent boys and girls nowadays, they don't know how to cook even dal chawal. So I think that's not good. At least they should know how to fill their own stomachs. So all the time they were reading, and as parents we thought studies are very important, and we used to always feel that we used to keep everything ready for them, breakfast ready for them, clothes ready for them. So this is the time, you can tell them that you teach them about self sort of care. So they should be disciplined, self or routine. It's not that it's a big holiday and they get up very late. No, no, no. So they should have some fixed time, fixed routine, and let them, both of you can negotiate. Especially while speaking to adolescents, it's not nice to dominate. You can allow them space and actually have a dialogue with them that, see, this is the time how we can spend tomorrow. So both of you can sit together and have a timetable, which will give something like, where you can spend together. So morning, at what time you'll get up, you can do exercise together, you can have breakfast together, you can actually cook the food together. So the children, adolescents, they all love all these things when they are doing spending time with the parents in a very uh, nice enjoyable way. So there are many things you can do, spend time with the children, learn new, they love actually should be, know the adolescent what they want. So nowadays adolescents are more into media. So you can become Facebook friends with them. You can also learn a little bit of technology as parents. And instead of always telling them you are always keeping your room like this, room like that, you can just be very friendly with them and appreciate them, and say if they have one day, let's clean up your room, some things like that. And this is the best time to spend with each other, with your children. There's so much
Thank
to
you,
talk
ma'am.
about it, Sri Krishna.
Yeah. Thank you, ma'am. So it's all about living with them. The best way to take care of them is to live with them. And no better time than now. We can't even run away from each other now. So we saw how the country is going to transition to a different new normal. We have seen how the nurses need to take care of their work in the college, of themselves when they step out to a market or to public place, and then of themselves, how to they take care of, how to take care of the elderly, how to take care of the children, and more importantly, how to take care of yourself. The five mantra which I have put up. So that finishes our segment, and we'll be happy to take up questions. But before I close the session, heartfelt thanks to all the healthcare workers, and this is to all the nurses who are giving their valuable time, energy, and their service to fight this epidemic. There can't be better and effective, more effective frontline warriors than you. Thank you so much for all the efforts that you have done. And together we'll fight COVID-19, and the nurses are the frontline warriors in this fight. So that's all from our end. I'll take up questions, and I request both the faculty to be around. Uh, Dr. Himabindu, I'll start with you. So one of the questions which has come up has been that when let me start and take up all questions. In fact, no question is too silly, no question is too small either. So the first question, Dr. Himabindu, is that right? Is it advisable now that the monsoon season has started and there will be common symptoms like cough, flu, etc.? How can we diagnose? How can we know whether this particular illness is because of COVID or something else? Is it advisable to go for COVID testing or to do a normal blood investigation?
I think with this pandemic around, if this pandemic was not there, it is a different scenario. But when this pandemic is there, the guidelines clearly say if you are symptomatic with fever, cold, cough, you need to be tested. So because it could be a COVID, so you better get tested in this scenario.
And ma'am, I know in Nilofar Hospital, you would have seen the scenario But when we are caring for COVID isolated patients wearing PPE, if there's an urgent need and we need to take rest or go to the restroom, what do you suggest?
There's an urgent need. I think you have to address your urgency. You need to open your PP and go and relax, and you can wear another PP for that.
Yeah.
And
So wear another PPE. Please
yeah,
don't reuse
please,
PPE,
please do
especially
not
in the
reuse.
government sector.
Yeah,
Yeah.
yeah.
Yeah. Dr. Bhargavi, what precautions we have to take in the nursing students hostel? I know this covers as good as home, but please, we'd like to listen from you in the nursing school and in the hostel.
I missed the initial thing. I think the question is to me, you know.
Yes, ma'am.
Okay, okay. The nursing school and the hostel, and so far it's closed for months. Just like reopening, like any other things, the mask cleaning and sanitization, and every room, the things have to be prepared. The environment has to be prepared thoroughly. That is one thing, and the most important aspect of preparation. That's for the physical environment. Beyond all, the school should have the teachers and the things before the students. The faculty have to join and start formulating solid plans for how to move ahead about the curriculum, and for which they have to take this stock of the completion of the things, pending things, and important things which can be provided within the limitations or the things. So a stock that is based on the institution consent. So the faculty and the academic committee has to really conduct the uh, meetings like through the virtual meetings, and to discuss and to come out as solid plan for implementation of the academics of post log on. And this include always that has to have the base of maintaining all that precautions to be followed in the for the as like any other COVID areas, because the social distancing. What I feel is the most difficult challenge in the college and the hostel is the distancing. Number is more, and if all the students have started, then it will be very difficult to manage, and that has to be really sorted out and planned properly with the things. That is a very proper planning is very important, and the guidelines have been given by the Indian Nursing Council how to conduct the examinations and how to finish the theory and how to finish the other aspect, which has been given by the Indian Nursing Council. The only concern with each institution is to plan it, strategies to be followed in consultation with the coordinators and the committee members, and then to announce the students. The second most important aspect is counseling the students. It's very, very important, because once till we step out, everybody is in a stage of fear. Until and unless we meet a COVID or meet a situation, then the fear is not going to. So counseling each student and removing their fear and anxieties and support, that is very, very essential. That is the second aspect which we have to take. And at the same time, like SOP, standard operating procedures have to be followed for each aspect. Now we are conducting the clinical classes also for the nursing officers. Each every batch of nurses before their posting, we conduct the clinical classes in small, the same methodology, same aspects, but we are repeating with all and ensure that everybody has undergone these settings. So this kind of proper planning and standard operating procedures have to be developed by the institution by themselves, considering their strengths and limitations and the areas to be covered and other aspects. Thank you.
Thank you, ma'am. Just an extension of the question. How are we going to plan clinical rotation for the students once they are back in college? And is it advisable to send the student nurses to different hospitals for clinical exposure? What do you think is the plan? I'll also request Dr. Vidyulata to please answer this.
Since
So
I
it
would like
is
Dr. Vidyulata to answer first, because it's mostly of Telangana, because I am in Delhi. So the situation may be different.
Yes, Bhargavi ma'am. So this is really a challenging and tough time for all the principals and faculty to manage in this time. And each institution has different challenges. See, clinical experience, already Indian Nursing Council has given the guidelines to be followed. And we have already followed completing the academic task, especially the theory part. In the beginning of the lockdown, everyone was scared and how to complete the theory classes. And there was a lot of uncertainty. But one by one, all these principals, faculty, and students of all the nursing colleges have started taking the online classes. And I think all the institutions have completed the theoretical aspect. In the beginning, there were many hinges, but everyone was able to cope up, and we have finished the theory part. Now coming to the clinical aspect, now we have, especially in our college, post master's students and post basic students, and government is insisting that the interns of the graduate program also should attend to the clinical duties. So we have instructed the students, but students, because of the family members' pressure and their own fears, they have not returned. And from June 1st onwards, we are making them to attend. And I think almost 50% of the students are attending the college, and 100% of us are working. And we are trying to streamline the things. As of now, clinical experience, I'm not in a position to tell, because all the hospitals are having the COVID cases. So the only option left with us is following the physical distancing, wearing the mask, hand washing, and taking care of self. That's it. I think we can send them in small groups. As far as possible, we can keep them away from each other by minimum 2 meters distance. But these are practically very difficult to follow, because there is a lot of rush in the hospitals. But still, we have to see how we can go about. And we are also waiting for the instructions from the Kaloji Narendra Rao University of Health Sciences, how to go about for the clinical experience, and also for the project work. Many MSc nursing students, they have to complete their data collection, and it is becoming a challenge. And for some of the students which are having the STPs, like structure teaching program and all, we are advising them to go for the Zoom webinars, pre-test, STP online, and post-test, and go for the statistician for the. But if it is directly involved with the clients, so we are just approaching. And right now we are avoiding Gandhi Hospital, which is a prime COVID center right now. So we are also every day, I'm having discussions with my HODs, how to go about the clinical experience of the coming examination and the clinical experience.
Thank you, ma'am. I think time will answer all these questions. This is a unique scenario for most of us.
Rightly
now
said,
I'd like to go down to those who had lifted their hands. I have Dr. Arjun. Dr. Arjun, please go ahead.
Hello. Yeah.
Yes, sir. Go ahead.
Yeah, it's a good webinar to sensitize the sisters about how to take care of them, their families, because I would like to salute them. I'm sure every doctor and every common man should salute the nursing staff, because they are the real grassroots level workers. They are the real ones who are doing work against such difficult odds, not bothering about their own health and safety. I will also like to emphasize that not only preventing COVID and other diseases, they should take care of their personal safety in terms of, because so many hooligans, and the fresh incident that is happening in Gandhi Hospital. So we have to take care of ourselves, because by the time the force comes, by the time somebody comes and rescues you, it is too late. So to prevent such attacks or violent attacks on the staff, we need to improve our communication levels, and also how effectively, what is the right communication to the patients or the attenders is very important. We have to be very cool, and also non-provocative and all. So despite all that, it may very well happen, but at the same time, we need to be very cautious about this, because my heart goes out to the PGs who have been attacked in the Gandhi Hospital. Same way, I'm sure a lot of sisters, they're not coming out and complaining to the authorities that they've been abused, maybe verbally or even physically also. So, however, I really salute them, and I'm sure a great Florence Nightingale, I'm sure she's done a wonderful job of starting the nursing profession and putting the nursing profession on such highest pedal of service. Thank you.
Thank you, sir. So the key message is communicate, communicate. Communicate on the case sheet, communicate to the patient, communicate to the attender, communicate to your team, not just to the doctor. Let everybody know and be informed of what is happening. And the more important thing, there are a few things like legislation and implementation which are difficult at our end. This is not really our job to have. That is the work of judiciary and the home services or the police. What is it that we can do? Try to understand and predict what is likely to happen. And we have all been in the field for long. We can quickly understand the psyche of the person whom we are talking to and what is likely to happen. And if we can keep our guard early, keep our guard up, and then detect all such problems early, just like we say early detection of complications, same holds good even for patient care. And these complications, some of them are really fatal, like in the patient care. So make sure you can understand it comes from small cues and the way in which they react verbally and non-verbally. Take care of it, and I'm sure it's a concerted action, a comprehensive plan. Everybody has a role, right from the chief minister till the superintendent of the hospital. Only when everybody is on board with us, we'll be able to prevent it. I have Sunita who would like to ask a question. Sunita, please go ahead. You can unmute and talk. Okay, we're not able to connect to her. Vishalakshi has raised hand. Those who would like to talk, if you could raise your hands, then I'll be, and please rename yourselves as well so that we'll be aware of whom we are allowing to talk. Redmi, please go ahead and talk. Okay, so we're not able to get them online. So I'll take up two questions which have come, very important questions. What precautions do we take when we're traveling in public services? Very, very important. Now that we're asked to work for extended hours, what is it that we can do? The same four principles. One, try to have face mask up all the time. How does this help? It doesn't allow you to touch your face or your mouth and nose. That is the purpose of face mask. So don't defeat the purpose of face mask by keeping it incorrectly or keep trying to adjust it. Second, try to have hand wash as the main weapon. Wherever you find water, have a soap container with you. If you find water, wash your hands. That is the best way to do it. If not, you can try to prevent unnecessary contact with any object. Could be the bus handle, could be anything, even in the auto. Try to prevent contact with anything which is avoidable. If you can't do that, or if you're still wanting to be more careful, try to have gloves and these gloves need to be disposed as soon as you go back to work. Next, after you come back home, make sure you look at what are the probable sources where the virus could be. One area is your hair, the back of your neck. Hair you would not wash after you come back home, right? But that is a place where the virus could stay and you go on to the bed and then it gets onto the pillow. So try to take a complete shower bath as soon as you come back home. That way, any sign of virus on your body will be off. Do not use your mobile when unnecessarily outside. If you have to use your mobile, try to have a cover on it. The moment you step out, let the cover come out from your bag and you put it on. So even if your hands have the virus, it will stay onto the cover, but not onto the mobile as such. These are small ways in which you will try to minimize infection while you are in the house, that infection which you have carried from outside into the place. Okay, so these are small things that will help. Don't take your footwear into the house, leave it outside. Take a shower bath. Try to have a shower cap, gloves, and whatever care you can take. And I continue to persist on this. Be more informed, be well informed, and care and share your resources as well as your thoughts with the people you love. The more you do it, the more confident you will get. Like everybody has said, we have to live with COVID, but then we can live with it with happiness and also with less of fear only if you are well informed. And this webinar also is one of the ways in which you will be more well informed. Now, there are scenes of risks which are there, but still the lockdown is being relaxed. What needs to be done? Frankly speaking, there are actions which are beyond your and my control. We can only do the best of our abilities. And as I said, continue to express your thoughts on Twitter. Try to tag the concerned people. It could be the GHFC Commissioner, KTR, Chief Minister, Prime Minister. Please do it. It is not unheard of, and it's not as if nobody is going to answer it. Try to have a sound rationale to what you say, express it in a correct opinionated way, and make sure you verbalize properly. And I'm sure you will find responses and maybe most of the time reassurances that all is being taken care of. Not all is well, but we are trying to get things back to as good as they can be. Any last words from Dr. Himabindu and Dr. Bhargavi, and then I'll ask Dr. Vidyulata to speak. Dr. Himabindu ma'am, just a minute for you to summarize.
I just wanted to say at the end, Dr. Sri Krishna, I'm very happy to be part of this webinar. Thank you for this arranging this and involving me and inviting me. I would like to say, all the nursing friends here, Amma, you are very, very important. Please take care of yourself. You're very, very important for the healthcare system. You're very important for your family. You're a mother. Most of them are women. You're a mother. Children are dependent on you. We are the caretakers for our family. So your mental health and physical health is very, very important. As a woman, I feel that, we women, most of the times we always do for others. Take care of husbands, take care of children, take care of others. But we don't take care of ourselves. So please take care of yourself also. If you are healthy and happy, you can spread happiness around. You can take better care of your family. So please take care of your diet. Please sleep well. Please take all the precautions what is professionally required in COVID times. Wear a PPE properly as per the guidelines. And then when you come home, take all the precautions and maintain, social connect. Distancing means I always said, okay, in the public area, you can have social distancing. In the family, please connect yourself with your parents, with your husband, with your children. Have a good time with them, and so that your mental health is very good. Eat proper food. Keep your immunity levels very high to fight the virus. We know that our immunity only can, actually, that's the only thing which can help us. So please take care of your diet. So with this thing, take care of your diet, take care of your sleep, take care of your mental happiness. Please enjoy all the hobbies, all what you want to do during this quarantine times, when you're giving a break from the work. Please do all that. So with this little, we should enjoy and our work and also our family. And this is something very, very unprecedented time, very, very different from, we never saw such days earlier. But take it positively. Please do not get depressed. Do not have any negative frame of mind. Please be very strong emotionally, be positive. Sab kuch, no, we'll definitely fight this and we'll definitely face it. Be very positive, but take all the precautions. Thank you. Thank you, Sri Krishna.
Thank you, ma'am. Dr. Bhargavi, last words.
Thank you very much. Maybe I'm happy to see that the situations are under control and the government of, the Telangana is a bit in a better condition than the Delhi. So that's why the story also may be different. From the Delhi experience, but I'm telling this may not be there in the state of Telangana, but what I want to say that never give up. There are lot of challenges and we may be just pushing to the forefront without any preparation or anything, and we have to expect more, but not to give up the things. And believing in oneself and keep on learning, preparing ourselves and to make to face the challenges. That's very important. That mental preparation and stamina that we are the people. Here in Delhi, the current, because of the increased caseload and the things, the situation is that neglecting, or it's just like a rat race, but to protect ourselves, that is the first motive. And neglecting others, that is the thing. It's not, we cannot blame anybody. So naturally, there will be another mentality to blame each other. So these things which I wanted to stress, that not to blame the government or the guidelines or the situation or anybody, but to sustain in this situation, to be learned and be informative and to follow the things and to get help when and where it is necessary, and to provide help to others and to maintain such a harmony and teamwork in the practice. That is most important. Thank you.
Thank you, ma'am. Dr. Vidyulata, ma'am, you can summarize it. And before I come to you, ma'am, there was one question apparently which I've missed.
Yes.
So the nurses from NICE Foundation have said they need to get to the community and work with the postnatal care, on postnatal care, antenatal care, and do home visits. If you can tell them what care they should take, and then give your closing remarks.
Thank you, Dr. Sri Krishna. It is nothing but, again, the 5 Panchavarsha Pranalika, what you have given, the 5 important points, especially wearing a mask, maintaining physical distance, and hand washing. And they can avoid with the help of their teachers or with the facilitators, whoever is there, avoiding wherever there is a high risk case, and then they have to educate and they have to involve the local leaders. All these precautions they have to take. And community also, lots of awareness is required. I think with this, we will have the closing remarks. So, good evening, all the participants and dear panelists. It was an amazing webinar and excellent moderation by Dr. Sri Krishna. We thank you for highlighting the nursing heroes of COVID-19 and also enlightening us on Government of India guidelines and SOPs and new normal etiquette. And I thank Dr. Bhargavi for sharing her experience and for accepting our invitation. And ma'am, it is really very challenging. And the challenges are very specific to each institution. I think we will follow the guidelines of Government of India Government of Telangana, Indian Nursing Council, and College Narendra University of Health Science with regard to teaching. And I thank Dr. Himabindu, HOD of Neonatology, Nilofer Hospital, for focusing on and highlighting and focusing on human touch. And you spoke a lot of positivity, importance of positivity in the life and quality time. And you have also taught of given information about mental health and taking care of the elderly at home, which is very informative. Thank you, ma'am, for your valuable time. And in the last, I think I should thank Team UNICEF, especially Dr. Sri Krishna and Dr. Sanjeev Upadhyay for organizing this webinar and contacting us. And I thank all the participants for their active participation. And dear all the participants, I think finally I have to summarize that we have to be informative from reading from reliable sources, share and care, express, stay safe, and reinvent yourself. Thank you.
Thank you, ma'am. And we couldn't have the additional director of medical education online, but I have her audio clip. So I would just like to play the audio clip before we.
I think it is additional director of medical education, Dr.
Yes,
Vani.
Yeah. So I'll just play the video clip, audio clip.
Good afternoon. I'm pleased to note that the Department of Nursing, Office of the DME, Government of Telangana, along with the collaboration of UNICEF, is conducting a series of webinars for all the nursing professionals on the topic nursing care in COVID scenario, which is the need of the hour. I extend my best wishes for all the participants and organizers of the webinar. Thank you.
So that's from Dr. Vani ma'am. And last, ma'am, I'll end it exactly after 2 minutes. Request all the participants to just stay with me for 2 minutes for something which will make us feel very good at the end of all this. We've been through so much, but this is something from, I would say, the government. Please watch it and listen to it, and then we'll close this session. So that finishes the session. Thanks everyone for your participation. Please continue to do the heroic work each of you is doing in the field. We'll again meet you at the next webinar. Before you log out, please press on leave meeting and then finish. We have vote of thanks. Ma'am, please, I need the person to identify themselves by raising hand. So, ma'am, Vijayalata ma'am, vote of thanks ever chepnaro valani, if you can ask them to raise their hand.
Madam Kamala.
Kamalana, నేను ఒకసారి చూస్తా. Yeah, she is there. మీతోనే ఉన్నారా మేడం?
Yes.
Yeah, madam, please go ahead.
Yes, sir. Good evening, everyone. I, Mrs. Kamla, Assistant Professor in Government College of Nursing, Hyderabad. It is my great privilege to me to propose the vote of thanks on behalf of Directorate of Medical Education, Telangana and Nursing. Honorable Deputy Director of Nursing, Telangana, respected panelists and faculty, my great heartfelt congratulations to all panelists and participants for today's webinar on nursing care in COVID scenario, care of self and community. At the outset of, I would like to convey my sincere thanks to Dr. Ramesh Reddy Garu, DME, Government of Telangana, for granting and permission to conduct this webinar. I thank Dr. Vani Madam, Additional DME, for her excellent message. I thank Dr. Anil, member of UNICEF, for his valuable opening remarks and for their initiation and conducting this webinar. I would like to extend my warm thanks to all panelists, Dr. Dr. Sri Krishna, State Consultant UNICEF, Dr. Sanjeev Upadhyaya, Health Specialist UNICEF, Dr. Bhargavi, Teacher in RMC Hospital, New Delhi, Dr. Himabindu Madam, HOD of Neonatology, Nilofar Hospital, Hyderabad, Dr. Punita, former Dean in College of Nursing, CMC Vellore, and EC member in INC, for her encouraging message and her wishes. All sessions were excellent and it is very much interesting to all the members. Finally, I would like to convey my thanks to all the dignitaries, participants, to making this webinar very grand success. Thank you very much for giving me this opportunity.
Thank you, ma'am. Could we close the session now?
Yes. I
Thank
think
you. Thank
there
you
are
so
some.
much.
There is
Yeah, so this session was specifically for the faculty of the nursing colleges. I think the next session will be very interesting, where we have more of the students and the nurses on field who will be part of it. So my thanks to all the nursing faculty for sparing your time and participating in this. Through the Directorate of Medical Education, Government of Telangana, we will continue to engage with you all, and our best wishes as you get back to the field and continue your selfless service. That's all from our end. Make sure you press on leave meeting before you exit. That way the app will not run in the background. Thank you so much.
Thank you. Thank you, sir.